In July 2021, the GHA Mental Health Service launched its crisis pathway with a single point of contact via 111. This strengthened the response from our liaison and crisis support team. Patients can now ring one number. Their needs are clinically triaged using an evidence-based tool. They are then rapidly assessed and an appropriate support package is put in place depending on the nature of the crisis and presenting problem.
So the mental health liaison team is comprised of 5 registered mental health nurses. We formed the team in 2019 to create the link in between mental health services and physical services. So we are based down in St Bernard's Hospital and our primary role is to do mental health assessments. The service users have greatly benefited from the introduction of the crisis pathway because 111 now gives them a single point of contact. So they don't get confused going through different departments. They contact 111 who are able to triage their symptoms and give them a timely response, whether that's the patient is in crisis and needs to be seen within 30 minutes in the A&E department. They will direct them there and can even dispatch ambulances. Or if it's more appropriate for the patient to be seen in clinic the next day or a GP appointment within the week, they can arrange all of that. So it takes the confusion out of navigating the healthcare system away from the patient and allows them to just focus on what they need to feel better. So the crisis support that we're able to offer at a team at the moment primarily consists of telephone calls and a couple of face-to-face appointments following an assessment in usually A&E. We also do have a regular clinic with our consultant psychiatrist where we are able to see patients as part of a multidisciplinary team. So the aim of those appointments is to assess response to treatment, to reassess the mental state and risk, to see if the plan needs to change, if any of the factors of the patient's condition has changed. We also can complete referrals onto other services, whether that might be back to primary care, which is your GP, or onto secondary care if you have a chronic and enduring mental illness.
So the liaison team has been a huge success in the emergency department. We are able to see patients in about 30 minutes, those patients who are in crisis.
So I think the mental health liaison team are incredibly important to the community as a whole. Our service users depend on us now. We have, service users in our community who come specifically seeking our team when they are in crisis, and they have made it known through their feedback how important it is that we are here for them and that they have come to rely on us as a team. We also provide valued advice and support to all of our colleagues within A&E, the medical wards, police station and the wider community, whether that be third-party organisations, relatives, on how they can best support people within their care and access services.
So prior to the mental health liaison team, there was nothing. It was all done by the consultant psychiatrists. So they would be doing on-calls on top of their clinics and then having to be called out throughout the night. So the development of our team made a huge difference to them, obviously, and also to patients being seen quickly.
The nurses are doing a fantastic job. They're really competent, hardworking. They've gone over and above the call of duty to support patients who are in crisis and who are at points where they need significant input. And it's been really good, the ways that lots of staff have adapted to this new role with a sort of focus on patient-centered care delivered in the community.
The figures on the slide that you can see demonstrate the success of this service. It shows that over 569 people were rapidly assessed last year by our specialist mental health liaison and crisis team. Furthermore, 447 follow-up support appointments were provided in the community to support those in crisis. This service has reduced the need for people to be admitted to hospital at times of crisis and enabled us to support people in their own homes. The evidence is that people recover more quickly if they are well supported in the community where possible. It also means that instead of our admission ward always being full and it being difficult at times to find beds, that there is always a bed available for those that do need admission to hospital. Another pleasing aspect of this service is that people are now able to receive more intensive treatment and support whilst in the hospital. As a result, they recover more quickly, stay in hospital for shorter periods of time. We now actively support better with follow-up in the community to a much higher standard when they are discharged home. Finally, a good indicator that this is working is that people are now less likely to be readmitted to hospital following treatment and support during a crisis. And the readmission rate to hospital for a mental health need has reduced significantly. At times of crisis, people now choose to use our crisis service.